So I'm Dr. Ben Anderson. I'm a professor of surgery and global health at the University of Washington in Seattle. And in the context of why I'm here in Ghana, I'm the director of the Breast Health Global Initiative. And what we focus on is breast health care in low and middle income countries.
So Ghana is one of those countries in which you've been involved for some period of time?
Ghana is actually the paradigm country for us of the low resource environment. And we started coming here in 2004, and we're developing model programs, working together with Hope Exchange to create solutions to address cancer care. We use breast cancer as a model for other cancers. If you can take care of breast cancer well, actually there are many cancers you can take care of. So there's a whole transition at the international level, the World Health Organization and other international groups, to start to address cancer. And we're one of those sentinel programs.
Why Ghana?
Well, we came here, we had colleagues that were doing trauma work, and so the reason I came here in the first place was because someone had said, you know, gosh, there are just some countries that are so poor that there's just no point in addressing cancer, or certainly not breast cancer. And I thought, well, that's an interesting point, but then that begs the question, what is it that makes you not ready to do cancer? And so we came here to learn about that. And what we found was there certainly were some key issues we learned about, but actually they are ready, and they are doing it. And therefore, what we wanted to do was learn how can we learn from our colleagues here at the same time that we improve the delivery and get it better, because breast cancer still has a very high mortality here.
So you said you learned from your colleagues here. Is this really an exchange of information? Is it about you all learning from each other?
Yes, that the Breast Health Global Initiative and Hope Exchange developed a model called the Learning Laboratory. And the idea is that we bring together experts from both high resource environments together with experts from the low and middle resource, and to problem solve. And no one understands everything. We all have something to contribute, and we all have something to learn. So I may know a fair amount about how to do breast cancer in the U.S. I helped develop guidelines in the U.S. for national standards. But those rules don't directly apply here. And that was what got us started on guideline development, and has been a source of our publication for the global summits that the Breast Health Global Initiative has run.
So what have been some of the initiatives you've done in Ghana with Hope Exchange over the last few years?
So we recognized that there are really three key areas in trying to address cancer, and these are the fundamental aspects of the Learning Laboratory. One of them is education and training. One of them is technology, and actually resources. The finances are really only a secondary aspect of this. And so together with Hope Exchange, the Breast Health Global Initiative has now run 2 breast cancer specialty courses together with our Ghanaian colleagues for the Ghanaian physicians, surgeons, nurses, and civil society, meaning the advocacy groups.
And how many people have participated in those? For example, right now, how many people are participating?
Our first global summit had 160 participants, and this meeting has had about 125. They come from these different environments by invitation, and it's a mutual exchange. What we did this time that was different, last time we had one large course with everybody together. This time we had some general education, but then we broke into sections, and we had part that was for the doctors, and then a separate section for the nurses, and yet another section for the advocates. The reason advocates are absolutely critical, these are in the U.S., this is like Susan G. Komen for the Cure, these advocates are the ones that drive awareness. Because you can build all the systems, but if the women have misinformation, if they think they're going to die if they just get a cancer diagnosis, they won't participate in early detection. If you build it, they don't necessarily come. And that's where the advocates fit in. the nurses, of course, are actually the ones that make the system go. Doctors often don't appreciate how absolutely vital nursing is. And nurses don't always speak out in the set when they're sitting with doctors about what the issues are. And so we had separate training and exchange with our Ghanaian nurses. Learned a lot.
What difference do you see this making in the way healthcare is delivered in Ghana?
Well, an issue in Ghana is that the comprehensive operational system was something that we've really taken for granted in the U.S. and Europe. That's not a common concept here. It gets broken into pieces. And there are many components to this, some of which you can't fix right away. Having adequate healthcare insurance, for example. But the concept of making functional systems, I think, is really a big contribution that the Breast Health Global Initiative and Hope Exchange are bringing to Ghana.
And how does this impact the rest of sub-Saharan Africa and even the rest of the developing world?
Well, the models that we're developing these are pilot programs, the goal of which is to sort out here, how does this work? And then through this implementation science, that is the study of how you implement, which is the third component of the learning laboratory. We study what worked, what didn't work, and how can we incrementally improve, actually measure outcome. That is something, what we're doing here in Ghana, our next step will be multi-country, and where we're going to do some special training and bring in, I'm anticipating doctors from other surrounding sub-Saharan African countries.
How has this changed the way you practice back in the United States?
Well, for one, it makes me profoundly appreciative of how fortunate we are in the U.S. We just don't realize how lucky we are until you go somewhere and see what they don't have. As an example, as a surgeon, we get pathology reports. And one of the basic level resources that we learned about when we came here in 2004 is you have to have high quality pathology reports in a reasonable period of time. At that time, a pathology report would take 4 to 6 months to generate. And how can you treat a cancer if you can't prove it's cancer for 4 to 6 months? So when I used to complain about my report taking a week, I think a week's not so bad.
Why is it this new hospital that Hope Exchange is building for this effort?
I think Hope Exchange has a tremendous opportunity to create something special in Ghana. An issue, and this isn't different from the U.S., we all get locked into our systems. But I think that Hope Exchange will be a complementary facility. Their focus is going to be on specialty education. So it's like the old give a man a fish, feed him for a meal, teach a man to fish, feed him for a lifetime. And that really is the philosophy of Hope Exchange. What we need to do is improve capacity. So we're not here to fix breast cancer for Ghana. That's not realistic. What we want to do is give people in Ghana the tools so that they can fix it themselves. And that is a core value of Hope Exchange.
And do the people of Ghana want these tools? What are you finding from the people you meet? Are they ready for it?
I have to tell you, I'm really crazy about the Ghanaian people, and I admire them tremendously. And there's a culture here that's really well suited for this. They're positive, they're optimistic, they're cheerful. You look and you think, gosh, the resources are so limited in comparison to the wealth we have, and yet the people really are so upbeat, and they work hard, and they want to make it better. Just today, when I was watching Dr. Jay Harness teach how to do an ultrasound guided biopsy in the breast, and these Ghanaian surgeons were crowded around and watching, and they were observant. They're plenty smart, and they were trying to figure out, how do I do that? And that's what you need. It's heck, when you teach a class, you want good students. The best students are here in Ghana.
I understand that you have a student with you right now from
University of Washington. Yes, so Ibrahim Ali, and he goes by Ali, he was a gift from God. I gave a talk on the work that we were doing in Ghana back in Seattle. And this young guy comes up and says, I'm a social work student here, and I'm from Ghana. Can I work with you? And to make a long story short, he has been absolutely invaluable in helping us organize this. Something that I've come to learn, you can come in from the outside, but you don't really understand someone else's culture any more than someone coming to the U.S. immediately understands how we work. And so you need to have people from the culture working with you that also understand your culture so that you don't make blunders, so that you communicate well, so that you don't offend people, and so that don't seem like it's entirely making sense. They can help you understand what was going on because the rules are different.
So if someone wanted to Hope Exchange, what could they expect to see as a return on this?
I believe that Hope Exchange and the Health Global Initiative have the opportunity, the potential, and I believe the future to change healthcare around the world, developing these models that will the World Health Organization in the 90s had basically written off Africa for HIV. They said, we can't afford it, it's not possible. And there were a group of doctors and scientists and nurse providers that didn't buy it. And HIV has been dramatically changed in Africa, really proved that it is possible, that we can lift ourselves by our bootstraps. And that's what this is all about. This absolutely is doable. And I believe that Hope Exchange and the Breast Health Global Initiative, that's the potential we have. I think we're on our way.
Anything else?
My pleasure.